Well, good evening, everybody. I'm Mia Neeson. I'm a congressional candidate in Maryland's 1st Congressional District. Tonight I am joined by the first Vice Chair of Maryland's Carroll County Democratic Club, who's also an adjunct computer professor from the University of Maryland. So please take it away this evening, Mitch, because you're our host asking me the questions tonight.
Well, thank you, Mia. It's a pleasure for me to have this opportunity to talk with you and to hear what you have to say. And I especially want to welcome the people who are tuned in today, and thank you for taking the time to find out who Mia is and to find out where she stands on the issues, which is what's going to help us get her elected to replace Dr. No up here in Carroll County and the Eastern Shore. Mia, are you ready for your questions? Your first one?
Of course, you know, they're always going to be tough questions with Mitch.
I'm not so sure. Mia, first, I'd like your thoughts on the importance of expanding broadband access to all Americans, and especially to this region, and the challenges that we would face in rural communities getting high-speed broadband.
I think it's one of the toughest challenges we face in this current age right now. So many people in our communities are faced with having to choose between, you know, picking the internet, their kids going to school in person, or having to find a new job and having that internet and their health care. So making sure that our rural communities get it is a day late, dollar short. And waiting till 2021 to get it installed is just not the right answer. I really want to be able to see change for our rural communities and bring this technology forward so that we're not left in the Stone Age for everyone in our community.
Thank you. Continuing on that thought, is getting access to broadband for rural communities going to be solved in some form of government-private communications partnership? Or how do you see that happening? How do you see it evolving?
Well, we've had legislation passed here in Maryland. And sadly, it's going to start in 2021. So hopefully, if elected, we can maybe work with other House and state legislators to work with the governor to maybe bring that to the federal level to get the contractors maybe some additional money to start the contract process right now. If we can bring it to the federal level so that people can start seeing the benefit of installations happening sooner rather than later.
Okay, thank you. And again, continuing on this thought, the importance of broadband it really makes this an issue worth exploring. And that is, we know the size, it's a huge undertaking to install, to build that infrastructure. And the costs are going to be an issue no matter how it's done. And do you have any scenarios, any possible solutions for ensuring that however that is done, the costs don't roll down and encumber our population once they do have access to it? How can we make this affordable?
I think it can be affordable because, you know, once we bring it up to the federal level, we can make sure that it's part of an emergency management situation, or make sure that it's passed in a bill so that it's part of like the prior telecommunication bill, or the making sure that everybody received power a long time ago, like the FDR did. We need to make sure that this is actually treated as a utility, not as a privilege for folks, so that's not something that people just make profit off of. So we want to make sure that we get it installed, and that if we have to, we make sure it's fully funded and we provide the block grants.
Thank you. And finally, one more question on the entire issue of broadband. It's once installed, it's not going to stay pristine, and it's going to need maintenance, it's going to need updating, it's going to need repair. And how is that going to work in rural communities? How can we ensure that the infrastructure stays viable for people?
Well, I definitely agree with a lot of the new ways that we are doing things, especially with making sure that things are sustainable, renewable, and of course, you know, providing a job for everyone in our future. So no matter if it's IT infrastructure, that we provide an option to make sure that we maintain this. You know, a copper cable may last 10 or 15 years, maybe 30 up to 100 years, But if there's a storm or something that needs to get replaced, it's normally hung in a rural area. We need to be able to make sure that it's dug in so that it's actually there for a lifetime for the entire community. And with our shores getting washed away, we need to make sure that where we actually put a data center or hub is further inland, and that it actually has a pumping system to make sure that it is, doesn't receive the damage from any type of future flooding.
See, thank you. And if broadband were available, and if we actually had this expansion of rural broadband networks, what job opportunities do you see and made available by that expansion in these communities?
Well, I definitely see a lot of high-paying jobs, okay? This is something as far as making sure that the installation gets put in, people who are going to be monitoring our internet, people who are going to be protecting our internet from those overseas, and making sure that, our normal internet that is going to be reinforced and sustained for the future stays intact so that we can keep it for the next generation. So we're definitely looking at 5 to 6 jobs per every neighborhood and community that's going to be a part of everyone, regardless of where we install it. So this is the future opportunity that I see that's going to help everyone, and it's going to be a great paying job, because when I used to work in the military, they were offering $65 per hour for this, and I was baffled by it. And this was fiber optics, and for a cable person, between $25 to $35 per hour, I was completely, amazed that I could go get a job to go pull cables, and I loved it.
Excellent, excellent. I have some additional questions that I received recently, which I'd like to ask you if I may. And
Sure.
Involving schools and schoolwork, one of the issues that seems to be true here is that some studies have shown that rural communities in particular do not have as many of the science and technology and math courses, the STEM courses, as suburban and urban schools. And do you have any thoughts on how we can address that problem, what we can do to attract that particular skill set in our schools here?
I think that's just an incorrect mindset. And, I think that we need to be able to incentivize our schools, incentivize the corporations, incentivize the small businesses out here to provide a STEM type of technology to the schools. We need to invest in the students, because no matter if they're 9, 10, 15 years old, they can become your future employees. So if they're, wanting technology to learn how to do something now via YouTube or LinkedIn, or in their school where they're supposed to be learning online for 3.5 hours per the governor, we can make sure that they have that face-to-face time with maybe a future employer to show them that, hey, look, they're sponsoring this school. They're going to invest in this school, and they can stay here in this state, and they don't need to leave and take a job away from the state. So that would be beneficial for the manufacturers here in Maryland to invest in our schools, provide that technology that is going to be invested into the manufacturing process to bring those high-paying jobs here to Maryland.
Excellent. Thank you. Thank you. We've talked a lot about infrastructure. Part of that, of course, is health system is part of our cultural infrastructure. And one of the things that we know about this area, and that in rural areas in general, the Shore District 1 is that type of area that I'm referring to, is that while there may be some adequate coverage of primary care doctors for the area, and even that's a question, one of the great deficiencies in this area is specialists. And as a consequence of that, when people need specialized care, it's not here. People have to travel. And I wonder if you have any thoughts how we can make this area more medically self-sufficient, how we can attract those types of physicians when we don't have the high population density.
Well, one of the best things that I've seen in my military health career was this thing called telemedicine, where I could get online, email my doctor, pick up a telephone and just call a doctor and get an appointment. And it was when I was in the Navy, and then when I joined the Army, it kind of went away. But when we got our last president, it came back with the ACA. And then when I came through with Trump, they gave us choice, which wasn't really a choice program because the choice program that was there beforehand worked. Now we're looking at bringing Medicare for all for everyone. And I tell you that in our rural communities, trying to reach a doctor in this pandemic is normally a voicemail because their offices are closed, they're out of business, or if they've relocated their entire practice. So telemedicine is where it's at, where we can actually reach our patients, see our patients as you and I see each other, and basically review the medical records, send somebody to go get tested, and then stay safe. And then get the results live without having to do a follow-up and then spend another time to get another visit and then pay another copay and everything else. And this gives us more direct time with our nurses and our doctors who are going to be able to treat us better and not treat us as a number and give us more hassle about our insurance provider not wanting to cover the bills or pay for it. So, telemedicine is going to be super important for our rural communities. And it appears that we had a question come in. Did you want to read that?
I don't have it here.
Okay, I'll read it.
I don't see it here. I'm sorry.
Okay. How can we incentivize healthcare professionals to practice in rural areas?
Yeah.
So
we've been talking about.
Yeah. So you were also talking about the whole specialized healthcare. Heart surgeons. Also, like for my feet. I have issues with my feet. I've been walking around knocking on doors crazy, and the governor has just now given us phase 3. So I'm kind of excited to get back out there. So it's going to be important to incentivize these doctors to say, hey, look. We understand that we only have one health care provider out here on the shore. We need to make sure that with Medicare for all, that we actually are able to pay them what they ask for. Okay? So that, when you look at Kaiser or Aetna or others, this is why they left. Because they saw us as, not profitable. With Medicare for all, you get what you pay for. And you get seen, and you can stay here on the shore and run your practice to help everyone on the shore. I think that's a great way that we can incentivize somebody who has a specialty to, come and teach here on the shore at a medical university. And I'm glad to see that there's a new hospital being built.
Excellent. I wonder if there are any people in the who are listening to us who want to submit questions at this time. Do we have any people Lori?
I think she dropped one in here.
How can we work with farmers on the Eastern Shore to move towards a more sustainable future? And that I'm going to refine that a little bit.
Okay.
And ask about sustainable agriculture, the idea of using minimal amounts of pesticides and growing items and selling them locally.
Well, I think with that, we definitely need to be able to have our EPA, our USDA, right, be able